And, when I said, well, we want to check a little bit of blood work, possibly get some radiographs or some x-rays, sometimes they look at me askew and go like, well, I thought you were a natural veterinarian. I go, I'm an integrative veterinarian, and I do the same reminder that you do, that I utilize all the tools, and there is definite place for a lot of this to happen, but there are certainly places for the other options that we can offer, which is really neat. Welcome everybody to Paws, Reflect, and Heal with Dr. Randy. We have a great podcast episode coming towards you today. I told this guy, actually, it was a misspelling on my email to him, but I told him that I think he's a brother from a different mother. And only because our lives in veterinary medicine had very parallel courses. But I'm very excited to introduce you to Dr. Kevin Toman. He is going to give you a little bit of his background and bio, and we're going to talk a lot about integrative medicine, quite a bit about some new things coming down the pike that you really should know about. We always remind you that you can we can answer any questions you want on drrandypetvet.com for myself or Dr. Toman. And we also have Dr. Toman's contact information posted on this when we get their show notes up. Kevin, welcome to the show.
Well, thank you very much, Dr. Aronson. I appreciate your time and your knowledge.
Just let's do Randy, if that's okay.
Okay. All right. Randy works just fine. And likewise, Kevin, all my life, I've just been known as Kevin inside the clinic and out. And so perfectly okay with that as well.
Perfect. Tell our listeners a little bit about your past and, how you got into veterinary medicine and kind of a little bit about your practice. And then we'll talk about what's happening today.
Okay. Well, my name is Dr. Kevin Toman. I have been a veterinarian since the dark ages of 1986. I graduated from UC Davis way back when. And honestly, it was the only thing I ever wanted to do. I'm one of those guys, for better or for worse. And once I got out of Davis, I spent some time up in the hills of Northern California, then 20 years of Colorado once I turned about 55 or so, that snow was a little bit less attractive to me. So I moved back to the central coast of California because snow's a lot less out here. And this is where I've lived since 2011.
Beautiful area. We love visiting that area. We just had some friends that got married a little bit inland and just enjoyed the heck out of it. So you and I graduated a little bit before you, but not too much. So I always tell people it's before the light bulb was invented for us. But I think we're parallel in the fact that it's really all I wanted to do. Also, I went to undergraduate school in pre-med, and there were no pre-veterinarians at this program, and everybody was wondering, you must be going into veterinary medicine because you don't really like people. And as you and I know, that couldn't have been farther from the truth. So I think the fact that you and I are doing this today shows our love for our pet parents, but especially our pets that we want to take care of. So talk a little bit about, so in the early days, probably like myself, you were doing a lot of Western or allopathic medicine. What happened, or was there a switch, or was there something that came about for you that said, I need to be looking a little bit more outside the box?
Well, so I'll give you a little bit more detail. And I actually started back, when I first got out of school, I was a large animal veterinarian, horses and cattle primarily. And yet I found that sometimes the economics of the veterinary profession dictating whether an animal survived or not, that was pretty difficult for me to live with. And so I gradually made a transition into small animal clinic and have been happy there ever since. In answer to your question, until about, let me do the math here. Until about 2001 or so, I was pretty much a Western medicine guy. You and I were likely trained in the same way, for better or for worse, because I can speak to some of the deficits in the veterinary training that I received anyway at UC Davis. In particular, no dental care at all back in the day. Just none. And certainly no dental radiographs, none of the things that you and I take for granted as part of the diagnostic workup these days. And yet, to answer that question of yours, a few years ago, 15, well, a little bit longer than that, 17 or 18 years ago now, I spent a lot of time in the gym, went in for routine blood work, Randy, and my creatinine was a little elevated. And so my GP at that point in time in rural Colorado ordered a full blood panel, and including serum electrophoresis. And come to find out, I had a pre-malignant disease called monoclonal gammopathy of, quote, unknown significance, MGUS. And that is a
Wow.
precursor for the fatal cancer myeloma. And so you can imagine it took me, took my attention. And I ended up working through a lot of diagnostics because I was being told by the local docs that I did have myeloma. And I self-referred down to the Mayo Clinic in Scottsdale, Arizona. Went through a complete workup, including bone marrow biopsy down there, and found that this was, in fact, a precursor, but not a malignancy. And the interesting part of this, I'm circling back around to your question, there's only one substance that has been proven to help slow the transition of this MGUS precursor into myeloma, and that's a natural herb called curcumin.
Yeah.
There are no chemotherapy drugs. There are no allopathic drugs, no Western medicines that are proven to work. And so that was that opened the door into integrative therapy for me, because all of a sudden, the antibiotics, the anesthetics, the things that you and I have in our back pocket all day long had been proven ineffective, and in their place was a natural herb that had been used for centuries by different civilizations. And so that kind of cracked the door open into herbal medicine. And then from there, I expanded into an acupuncture practice, a laser practice, and eventually into prescription longevity drugs, which is where your path and mine crossed.
Really cool. And it's amazing how for many of us, it's really a kind of, like you had described, self-necessity or self-awareness to kind of look outside the box when something comes up. I didn't have quite that bit of a journey. Just to give you a little background for me, I was practicing after I spent a year. I graduated Penn, and then I spent a year doing a rotating internship in medicine and surgery. I also went there thinking I was going to be an equine surgeon until I saw the economics of what happened with racehorses and how insurance money deemed everything. And it was just not why I went into veterinary medicine. So after that year internship in medicine and surgery, I went to the Animal Medical Center in New York City. The reason for me is I'm a visual learner. I could read 10 times. If I see something once, I'm good. And so, having 60,000 cases a year was amazing. And I was doing endoscopy and laparoscopy there, which was really fun. But I got out to Tucson, which is where I ended up starting my practice. And it was about 10 years into the practice that I realized for me that all I was doing was putting out fires. I was a great diagnostician. I'm not, giving myself any rubs on the back, but I was doing great. I mean, I was far above what was out in medicine at the time just because of my training. But I didn't feel like I was getting anywhere towards wellness, and especially not health span or longevity. Right. So heard about this guy, Andrew Weil, in Tucson. Dr. Weil is, a very famous MD that really started laying the groundwork for looking at herbal medicine and Chinese herbs. And I went and got training in Albuquerque for what I thought was adding Chinese herbs to my practice, only to learn I had to learn Chinese medicine, which was another whole paradigm shift in my life, which led to the acupuncture certification and herbal certification, and then from there, rehab certification, because of what I saw in my practice as a necessity for a lot of our senior pets, and obviously recoveries from surgeries and whatnot. So it was a great pathway, but it really took a long time. And I'm sure, like yourself, there was a lot of reticence from the veterinary community about what was going on. I actually, to kind of prove my point, started this radio show in Tucson, went for 10 years on Saturdays for 2 hours asking Q&A, and most of it was what you and I know about basically, how come methylcobalamin helps the bowel, or, why am I, and then, basically pet owners would go to their veterinarians and they'd be calling me and saying like, well, what are you telling this person? I don't even know anything about this.
Yeah.
So it was an educational process, but well worth it. I mean, obviously, and then I'm sure for you started seeing some amazing results in practice. Things that I could not put my finger on. I had this ongoing argument with the oncologist here in town about using turkey tail for mast cell tumors. And I told her that it worked as well as prednisone. I kept on harping on it. And then like 5 years into this argument between the two of us, Penn releases a study on turkey tail versus prednisone, and the results were equal,
Yeah.
So it's nice, I think, for both of us to have things borne out. But I think like you probably, and I'd love you to address this, the proof is seeing the benefit to our pet patients. I mean, to see what we can do to help them, especially not only to work on disease, but also on longevity, health span, and wellness.
Yeah, I could approach that in a couple different ways. Number
Sure.
one, I think, as you pointed out, most veterinarians are very good at solving problems. If Annabelle, my aforementioned 11-month-old golden retriever, comes in with a cut pad, you and I are very good at sewing that up. If she gets parvo, we're very good day in and day out at solving that. But what we aren't so good at is trying to develop a plan, an integrative plan that looks down the road and says, well, how do I help this 11-month-old golden retriever, as an example, a breed that we know is absolutely prone to cancer, absolutely prone to orthopedic disease, absolutely prone to allergies. How do I help that dog or that patient live their very best life? And what I found early on was that people were coming to me because they had heard that I was a natural doc, a naturopath. And one of the first things I told them was, well, in fact, that's incorrect. I do believe in the value of herbal therapy. I do believe in the value of a class 4 laser, but I also believe in the value of surgery and steroids and the occasional vaccine. It's just that I think that many folks, whether they be veterinarians, whether they be pet owners, tend to limit themselves to one approach or two approaches and think that they are doing all they can for their pet. And when I'm asked those questions, I start waving my arms around and say, well, we can use immune suppressants over here. We can use the turkey tail mushrooms over here. We can cut that rascal out. There's a lot of different ways to approach wellness for a pet. And in general terms, I like to think, it's the same approach to wellness that I use. I try to stay in shape. I try to eat right day in and day out. I'm not opposed to taking allopathic medicines, but I'm also taking the prescription longevity drugs that you and I might get around to at some point in time. I take herbal medications as well. And so I think it's a total lifestyle. And I think that as, I'm 65 at this point in time, and as folks of our demographic kind of grow up, Randy, and maybe face mortality, all of a sudden, I think there's increasing interest, I think, in taking an integrative, an all-encompassing view of our own health, and that translates very well to our pet patients.
Absolutely, absolutely. And, I think on the personal note, I'm on this very similar pathway. I mean, I work out 3 days a week in the gym. I actually have a gym in my garage, but I also bike 3 days a week. And I found that even just recently, this is kind of an interesting personal thing. I don't mind being transparent, but I wasn't feeling that well. There was a lot of pain and aches that I didn't feel like should have been normal, and I wasn't going to take a lot of the pain type medications and whatnot. And found a doctor who I think, like a guy named Peter Attia that many of our listeners may know about, practices what I call medicine 3.0, and that is really being proactive about, I realized that after doing a DEXA scan, I had way too much visceral fat. I was eating too many carbs. And, after that nutritional recycle for me and kind of doing a lot of biohacks, some biohacks, and obviously rapamycin, which we're going to talk about in a little bit. It's been amazing. You know, I lost 25 pounds. I feel so much better. And this is kind of what I look at for my pet patients, because many times I have a dog that's coming in for most of my cases now, my practice or my telemedicine cases are all second and third opinions. So I have a dog that, you know, is a golden retriever who's gotten to 10 years old, but he's having very hard time getting up. He doesn't seem to be feeling well. He may be a little bit more grumpy or aggressive. And I think my clients they're a little bit amazed in the fact that the first thing I talk about is diet and supplements. And we talk a little bit about some of the other things like you mentioned, class 4 laser. We have PEMF, which is pulsed electric magnetic therapy. We have underwater treadmills. Trying to get these guys into a situation where, you know, I make them aware that the dog is obese and needs to lose weight, body score, you know, of 7 and needs to be at 5. And all of a sudden, everything starts getting better. And the pet parent just is like so thrilled. And of course, I'm always so thrilled to see what's going on. And then I've added some newer things, and we can talk about in a little bit, using microbiome work that has really been impressive. With some of the allergy looking at some of the allergy stuff, and it's been great. It's been a godsend.
Yeah, I understand. And one of the things that you and I spoke of before is the fact that many pet parents have a tendency to reach towards the newest shiny object, whatever is in the news as a basis for their pet's health care. And the reality is, so often it comes back down to the basics. The same things that you and I speak of, whether it be exercise or nutrition, or for small dogs and kitties, the dental care that eliminates both pain and long-term inflammation. In the larger dogs, paying a little bit more attention to orthopedics or allergic disease, early cancer detection, et cetera. And some of these things are very simple to take care of and oftentimes very cheap. But the reality is that they play a vital role for our pet parents in keeping their pets healthy.
Absolutely, absolutely. Talk a little bit about, so you, I know you had a practice that you had sold not that long ago. What did you see as far as where you were going with this? I mean, did you visualize you being in the longevity space? Did you visualize this being a telemedicine consult kind of thing for you to happen? And exactly, like, tell our listeners what you're doing now. That would be great.
Well, it's been an evolution. I'm kind of a serial entrepreneur, and so through the years, and I kind of migrated to wherever there were either waves or trout. That was kind of one of the defining characteristics of the places that I used to live. And so I came to San Luis Obispo when I got tired of the snow and built what at that point in time was just a one doc practice, and grew it to a 5.5 doc practice, and 25, 30 some odd employees. And I just and then, to be candid with you, that was back in 2018, and as you probably know, that was kind of the beginning of the private equity move, the venture capital move into veterinary medicine. And I could talk at length about that from both a pro, but also a lot of cons. And the reality is that I was made that proverbial offer that I could not refuse. We had kind of a little bit of a referral practice going on at that point in time. And so we had a pretty good reputation. And I just knew that as my practice enlarged, I was losing one of the things that mattered most to me. And that was the contact with the individual. I spent more time as an administrator, I guess, at the end of the day, to get right to the chase here. I spent more time doing the paperwork and keeping the hospital running than solving things, and that's one of the things that I hold myself to be, is a little bit of a fixer. And I had lost that component of my day-to-day work, and so I just I took that offer that I could not turn down, I should say. And that freed me up to go ahead and explore the part of veterinary medicine that I really love, which is building that relationship, building that one-on-one relationship with an individual pet parent. and being able to say, listen, I'm going to follow your pet, not just for the days associated with a vaccine or a surgical procedure, but for weeks or months or years in an effort to really provide them the very best care. And these days, California has incrementally liberalized their telemedicine statutes as a result, probably of COVID. And I'm trying to take full advantage of that because we were laughing about it. And I was talking with another pretty savvy individual about business development, and he said, really one of the things we're trying to do is democratize veterinary medicine. And that sounds kind of funny, but not everybody lives in the Tucsons or Phoenixes or San Fernando Valleys, the San Luis Obispo of the world. I mean, some folks live in the Wise River Montanas or the Skowhegans, Maines. And I think that telemedicine, the access to a veterinarian like yourself who really cares about not just solving a problem, but about trying to build a longevity plan for this particular patient, can make all the difference in the world in today's internet age, where social media you can get opinions all over. But what you can't develop is a relationship with somebody, and that is my goal with some of the things that I'm doing right now.
It's, couldn't have said it better. I mean, that's amazing that, again, I think the evolution for both of us was very similar. I do remind my clients, we used to get initially people come in and say, well, I just want acupuncture for my dog. And I go, well, I can do the acupuncture, but let's just see what the situation is here so that we can figure out why we're doing that or what the necessity or what our plan is. Like you said, planning is always very important. And, when I said, well, we want to check a little bit of blood work, possibly get some radiographs or some x-rays, sometimes they look at me askew and go well, I thought you were a natural veterinarian. I go, I'm an integrative veterinarian. And I do the same reminder that you do, that I utilize all the tools. And there is definite place for a lot of this to happen. But there are certainly places for the other options that we can offer, which is really neat. So you sold the practice, you started this, was it beginning in telemedicine? Is that how it started for you, or was
No, it was kind of the mail order, basically just selling supplements back in the day.
Got it.
Because, I took my initial interest in curcumin and really did the research necessary to kind of find, without putting a sales spin on it, I did the research necessary to find what I thought were the very best ingredients, the very most effective ingredients around. And there's a lot of smoke and mirrors in the pet supplement world, a lot of marketing spin by folks that have never set foot into a veterinary clinic. And what I tried to do is to offer folks a little bit different approach. I tried to look at things, I don't sell, I don't even talk about things that don't have any science behind them. Really a PubMed study or two is kind of the entry, the door through which any supplement has to strive before I'll have a look at it. And I think that there was a need. People were receptive to that, and I grew that business one person at a time. There were some lean times to go along with it, but the reality is that now we seem to have developed a little bit of word of mouth. Folks that are kind of the type of medicine that you practice resonates with them, and so much like you, there's a receptive audience out there.
So talk a little bit to our listeners about, one, how people find you, and basically kind of what your goals are going forward from where you are right now.
Well, I don't want to make this an advertisement for myself.
No,
but
I'm asking.
Okay. Well, I run a couple of websites. I guess the one that most folks know me through is just helpingpetslivelonger.com. And on that, there's a mix of both prescription longevity drugs that are available by prescription from other veterinarians or after a consult with me. Some of the proven supplements that we've discussed, and then I'm really trying to expand the consult part of things, because I think there is such a need for pet parents to develop a relationship with somebody that they can trust, somebody who's in this not just for days or weeks, but for the long term. So that, there's nothing more satisfying to me, Randy, than seeing the puppy, the proverbial puppy that you and I take care of, we can give vaccines 8, 12, 16 weeks of age or whatever, guide them through middle age and eventually, approach palliative care with them and sometimes get, the next generation of pets coming. And that to me is really why I got into veterinary medicine. And so, I acknowledge the fact that there are many supplement suppliers out there, and that field's probably going to get a little bit more crowded over time, as you and I have talked about. But one thing I don't think will ever get too crowded is the ability to look somebody in the eye, even if it's on Zoom, and
Right.
say, "Listen,
Right.
this is what I think we need to do. This is how you and I, by working together, can help our pet." And I think that's very important.
I do too. Well said. And the interesting thing that I allude to a lot of my pet parents when they come to see me is a lot of what you said as far as what they're picking as far as supplements and why and many times I refer to Dr. Google as the N of one, meaning
Yeah.
I had this golden retriever, it had this, and I gave this, and this is the best product in the world. This Dr. Google's an N of one, and people like you and I have N of hundreds. And we
Yeah.
look at, the turmeric products, let's say, that are out there, or the curcumin products that are out there, and know how it's made, and know the quality, and know the efficacy. Same with the other supplements. And I'm with you. I think without any kind of research or background, I'm more apt to be a little skeptical until proven otherwise. And I think that really helps. Do you do a lot of your telemedicine cases by Zoom, or do you do mostly phone calls, or how does that work for you?
I try to do Zoom calls where I can. And the reality is that I like to look at the pet parents that I'm talking with. I like to be able to look at a pet,
Yep.
as goofy as that sounds, because sometimes what what a pet parent will say will describe sometimes is different. Looks different to me.
Yep.
Looks different to me. Whether it be a pet being lame on one leg, and maybe they turn out to be painful on another, or you and I might describe an area of baldness or hair loss or the like a little bit differently than a pet parent will. And so, in direct answer to your question, I start with a 4-page pet health questionnaire that I would ask you to fill out. Where did you get your pet? What is their lifestyle like? I mean, when they go outside, where do they spend time? How many other animals do they come in contact with? We discuss, preventive care, et cetera, the heartworm, the flea and tick medications, et cetera. And then I get very specific, what is your specific concern? What have you tried in the past? What has your local veterinarian helped? And do you have problems with your local veterinarian? Is there something that you feel like you guys just simply aren't connecting with? Because all that is vital information if you're really trying to get to the bottom of things.
Absolutely.
And then I do ask for the last 2 years of a pet's veterinary records as well, including all images and lab work, just to get a handle on what has gone on. And then the third component of that three-legged stool is in fact trying to set up a Zoom call.
Perfect. It sounds great. Yeah. So that's the thing that I think a lot of people like to know is that Dr. Toman going in is well educated on what's going on with your pet and basically what you're looking for and can think about what the options might be laid out after that's all assessed, which is great. Yeah, I think that's really important.
Yeah, and I will, and I'm sorry, Randy, to interrupt you,
No.
but I should mention that the other part of things that I've done, even in veterinary practice, is I made a habit. I forced all these poor doctors that worked with me. We always sent a written letter home for every sick pet that we saw, sick or injured pet. Now, this is not the standard, spay or neuter
Sure.
post-op instructions, but I believe pet parents are entitled to that written explanation of lab work, to a written idea as to prognosis or what the next step is. Because listen, when I go to my dentist or when I go to a doctor, I listen like hell.
Yep.
I'm paying attention, I'm paying rapt attention. But then I get home and I think, what exactly was said there? And so that's part of it. that's part of my philosophy around these consults too, is that at the end of the day, a pet parent will get anywhere between a page and sometimes 2 or 3 pages of a written assessment of their pet's health, not just where they're at right now, but where they're headed, in my opinion.
Perfect, perfect. Do your telemedicine consults, are they usually like an hour in length, or is there any specific time frame? Or
Yeah, yeah. Well, the homework is done ahead of that,
sure,
but yeah, then the Zoom consults themselves are set up on the hour,
perfect, perfect.
and so yeah, I try to give folks just as much time in the room as they need to run with this.
How do you get around the issue? I often get this question on medicine, actual prescriptions of medicine when you're doing these.
Well, I can prescribe within the state of California, but the reality is that outside the state, current veterinary laws, whether they, and you and I could talk all day long about some of this, to be candid with you,
Yep.
but current veterinary laws prevent a veterinarian from prescribing outside their state,
Yep.
and so. I try to work with local veterinarians, and many times, people already have a cabinet full of medications, just that they're not quite sure how to use them or when to use them. And so there are a lot of different ways to work with that. But I'm not, I want to be absolutely clear. My goal is not to alienate or to
Sure.
ostracize the local vet.
Sure.
My goal is to do everything we can. Again, work with specialists. I have a little specialist network that you and I can talk a little bit more about. So I try to bring specialists in as needed, but work with a local vet. Sometimes, the rehab vets, the physical therapy folks, in an effort to establish a healthcare team for these pets, a healthcare team instead of a one-man band.
Perfect, perfect, perfect. Let's take a little time, if you don't mind, and talk about rapamycin and how this came about for you and kind of what you see its situation and what it looks like in the future.
Okay. Well, yeah, rapamycin is probably the single most widely studied and widely used prescription longevity drug in the world right now. As a lot of folks realize, it came into human medicine actually as an immune suppressant, and in particular for transplant medicine. But what they found is that at lower doses, it had pretty profound metabolic benefits. And at this point, I think I can say categorically that it has extended life in every species studied to date, and in mammal species, typically by up to about 14% or so. And of course, that anything that extends life by what could be up to a decade for a schmo like you or me, or a year and a half, or 2 years for a pet. Now, listen, there are no guarantees. I don't think any medication works for everybody, but the potential for actually a safe intervention into helping our pets or helping ourselves live longer, I mean, that's awful appealing for a lot of folks like me.
Sure.
And so I began using rapamycin in my clinical practice back in 2016, 2017, primarily in an oncology setting, because you and I both know that it's difficult sometimes to have an oncologist or have a general GP doc just say, oh, there's nothing you can do. And there's pretty compelling studies in human medicine for a variety of different diseases, lymphomas, the various sarcomas of the world, mammary cancer, melanomas, in our case, anal gland adenocarcinomas, that rapamycin has a benefit for these patients. And I saw some pretty substantial results, especially with melanoma, oral melanomas, and anal gland cancer. And so based on that and its safety record, I eventually began taking it myself in candor, and then made that switch. I mean, so many people, the last thing in the world that a pet parent wants to hear is that your pet is growing old and there is nothing we can do.
Yeah.
There is nothing we can do. And listen, there are a lot of lifestyle change components to this, as you've already alluded to. There's a lot of standard medical therapies like dental care or sometimes vaccines or whatever that can help a pet. But if you truly love your pet, like you and I do, or like many pet parents do, you'll stop at nothing, you know.
Right.
And rapamycin, it has been proven safe. The studies support its use for both longevity and well, it has longevity, it has anti-cancer and anti-inflammatory benefits. And I'm going to talk a little bit more about cardiac care in just 1 minute.
Good.
And to this point, it's been an off-label use for both dogs and for cats. But there was a study that came out, put out by a company called Trivium, an Irish veterinary products company called Trivium, about a year and a half ago, that showed that rapamycin has the potential to slow, stop, and occasionally even reverse a fatal cardiac disease in kitties known as hypertrophic cardiomyopathy, or HCM. And why is this so important? Well, because HCM is the single most common cardiac disease that cats run into. And I'm going to be honest with you, in the 40 years that I've been in veterinary practice, up until now, it has been a uniform death sentence. If I told you that your cat had HCM, it was equivalent to telling you, go out and dig a hole.
Yep.
Go out and dig a hole.
Yep.
And now rapamycin is a safe alternative that, again, does not work for every cat, but I would tell you that in our hands, in the cats that we've had rechecked by echo exam, by veterinary cardiologists, about 3/4 of those cats have either stabilized or in a few instances, 10 to 15%, actually improved. And this is borne out by a study that a wider study that has been done and I think completed at this point at North Carolina State University. And so it's a fascinating time to be a veterinarian who's interested in longevity medicine.
Yes.
Because in addition to the lifestyle and the herbal supplements and the physical therapy that you and I are very versed in, now we have a whole different arm of medicine. We have a totally different way to help our pet parents help their pets live longer.
Yep.
And that's pretty exciting to me.
Absolutely. We're kind of running out of time, and I'm really sad because I think I have so much more that I wanted to talk to you about. Hopefully, maybe we could do this again.
No problem.
If that would be okay with you.
Yeah.
Is there anything you want to leave our listeners with? Anything new on the horizon for you, or anything changing? Of course, I'm going to have all your contact information if our listeners want to get a hold of Dr. Toman, want to get a telemedicine consult set up. But any closing thoughts, Kevin, at all?
No, not really. I just appreciate your work and the skill and time that you brought into veterinary medicine, because I can tell you that people with your passion, people with your dedication to healing pets, I mean, they're rare in our profession. I mean, sometimes it's easy to take the easy way out. Sometimes easy to limit yourself to what you were taught in school 20 or 30 or 40 years ago. And it seems like you're on the cutting edge of all this. And so I think that your clients, your pet parents, are very lucky to have you as part of their healthcare team.
Well, and back at you, because after I got to know a little bit about you, and especially with this conversation, I'm so impressed. I mean, I'm a little older than you are, but the two of us are still kicking and wanting to do this, and the passion is really there. One of the things I thought about is at some point it'd be fun for you and I to go speak somewhere and do something like this in person. We could reach out to some pet organizations or whatever, but it would be really kind of cool to kind of piggyback off of each other, because I think it works amazingly well. So maybe we can pull that off.
Yeah, I've often thought that there was room to establish kind of a pet longevity conference, and it's funny that I came across a human longevity. I try to pay a lot of attention to some of the human longevity conferences, and there was one in Switzerland, and I think it was Lucerne or don't quote me on Lucerne, but okay. The reality is that there was a human longevity summit in Switzerland that you and I just missed. It just happened this last week. And their statement is that they're putting together a pet longevity summit in Switzerland for next summer. And so, yeah, that's an intriguing thought, my friend. It's an intriguing thought.
It would be a nice trip, and we could have fun kind of laying out the pathwork for our pet parents and for people that would listen. Kevin, I can't thank you enough again for all that you do. I do definitely have some rapamycin people who want to talk to you, and I want to keep on as in all transparency. I also take it. I don't have my dogs on it at this point, but I'm working towards that. Had a little trouble with it prescription-wise. I will bounce that off of you, I think. I really, really appreciate all that you've done. And it is, for our listeners, this is really cutting-edge stuff. Spread the word. Check out Dr. Toman on his websites. Contact him if you'd like to have a telemedicine consult. And we'll come back with more Pause, Reflect, and Heal soon. Kevin, thanks again, buddy. I really appreciate it.
All right, Dr. Randy, have a great day.